This is the third lecture in the skeletal system. Our joints can be characterized by the physical structure or by their motion. A fibrous joint will be high in fibrous connective tissue and collagen, but lack a synovial cavity. A cartilaginous joint is two bones joined together by cartilage without a synovial cavity. A synovial joint has a synovial cavity, which is a fluid-filled sac between the bones. It is surrounded by an articular capsule and often has ligaments to support the joint. One of the things we often assume is joints mean motion, and joints are actually just two bones joined together. The amount of motion may vary. If we categorize joints by movement, we have the synarthrosis or immovable joint, the amphiarthrosis or slightly movable joint, and a diarthrosis or freely movable joint. The fibrous joints are held together by fibers and have little or no movement. One example is the suture in the skull, which is also considered a synarthrosis. Another type of fibrous joint is the syndesmosis. The example here is the tibia-fibular joint, which is actually an amphiarthrosis. It is held together by a band of fibers that wrap around the fibula and attach it to the tibia. The gomphosis is also a fibrous joint. This is the pagan socket joint, which is a tooth and is considered immovable. The cartilaginous joints are held together by cartilage. The first is the synchondrosis, which is an epiphyseal plate. This actually literally translates to mean without cartilage, and the epiphyseal plate is eventually without cartilage when the bone is fully grown. This joint is held together by hyaline cartilage in the earlier stages and is considered immovable. The symphysis is held together with a broad, flat fibrocartilage. Examples include the IVD or intervertebral disc and the pubic symphysis. We're going to look at an animation here on the types of joints. So you will also have access to this outside of this particular presentation in the links available. Here we will look at the structure of a synovial joint. A synovial joint will have a synovial cavity or space between the bones and will contain synovial fluid to cushion or reduce friction. The ends of the bones will have articular cartilage made of hyaline cartilage on the surface, which articulates with another bone. The articular capsule surrounds the synovial cavity. The outside surface of the articular capsule is the fibrous capsule, which is tough and durable. The inside surface of the articular capsule is the synovial membrane, which is smooth and slippery. Oftentimes, these joints will have ligaments, which might be inside the capsule, outside the capsule, or both to make them more stable. In the knee, we have an articular disc called the meniscus to smooth movement. The sternoclavicular joint also has an articular disc. Synovial joints may have bursa, which are fluid-filled sacs to reduce the friction in the joint. There may also be pouches of fat called articular fat pads to help decrease friction as well. This is an example of a typical synovial joint. You can see that you've got your top bone here, the membrane around the outside. You've got your joint capsule, articular cartilage on the two bones. You've got your joint cavity in here where you're going to have synovial fluid. Periosteum around the rest of the bone as well. There are several types of synovial joints based on their structure and motion. A planar joint allows movement side to side and back and forth, like in the wrist. Hinge joints allow for angular or open and closing motion, like at the knee. Pivot joints allow twisting motion, such as the C1-C2 joint and the radius and ulna. Condyloid joints are found at the metacarpal phalangeal joints of the hands and fingers and allows side to side and up and down movements. The saddle joint is one that is specialized and found at the thumb and allows side to side and up and down movements. In the thumb, when these are combined, it is sometimes referred to as opposition. A ball and socket joint allows rotation and circumduction. These are found at both the hip and shoulder. Here we will define exactly what is meant with the movements described in the previous slide. Gliding refers to the back and forth and side to side motion which occurs at the planar joints. This would be at the wrist and the ankles. Flexion decreases the angle at the hinge joint, such as bending the knee, and extension increases the angle, such as straightening the leg. Here we are looking at the angle created by the two bones. Abduction moves away from the midline, like lifting the arms straight out at the side. Adduction moves towards the midline, such as bringing the arms back down. Circumduction combines flexion, extension, and rotation for a circular movement around a joint. This is seen in ball and socket joints, such as the hip and shoulder. Rotation is twisting within the joint cavity and occurs in the ball and socket joints. Elevation and depression involve moving up and down and occur at the jaw and scapula. Protraction and retraction move forward and back and also occur at the jaw and scapula. Inversion and eversion occur only at the foot and ankle joint. Inversion has the sole facing inward towards the midline, while eversion faces away. Dorsi and plantar flexion are also at the foot and ankle. Plantar flexion points the toes away from the head, while dorsiflexion pulls the toes up towards the head. Pronation and supination occur at the wrist and hands. Pronation faces the palms down, and supination turns the palms up. One way to remember this is with the palms up, it's like you're carrying soup, or you can remember P for pronation and palms down. Here we're going to look at some animations of the movements. So flexion, we can see here. And we can see hyperextension versus extension. Dorsiflexion and plantar flexion, abduction, and adduction. So here we can see circumduction and rotation. And supination. And pronation. Eversion and inversion. One thing this animation is a little confusing on showing that the soles are facing in or out. It can be a little misleading with these pictures. Protraction and retraction. Elevation and depression. So you will also have access to this after the presentation to go through to review these. Repetitive strain injuries are injuries that occur from overuse. The overuse causes inflammation, which leads to scar tissue formation. In the process of inflammation, you have swelling, heat, altered movement from increased blood flow to an area, redness, and pain. This also brings more nutrients at the same time and increases the rate of chemical reactions. The inflammatory mediators trigger the production of pain. Scar tissue is weaker, more pain sensitive, and more likely to injure. Some common examples of repetitive strain injuries occur at the wrist and the fingers from things like pulling triggers or carpal tunnel syndrome repeatedly using a keyboard. Tendinitis involves inflammation of the tendons and is also due to overuse. An example is tennis elbow. These injuries can be acute or chronic and will also result in scar tissue. Generally, acute injuries will heal with a better outcome over the long term than a chronic injury will. Sprains and strains often will occur together. By definition, sprains involve ligaments, while strains involve the muscle and tendon. Since these are both around a joint, you always see them together. The severity is graded dependent on the amount of tissue damage and the number of fibers torn. These will also result in scar tissue.